especially when we know that some nurses have actually been threatened, have had weapons pulled on them, and that's got to be preying on your mind every time you speak to a patient.
Every year, nurses and frontline staff at the Health Sciences Center in Winnipeg face numerous challenges. But alongside the usual high-stress scenarios found inside of a hospital walls, numerous dangerous weapons are also making their way inside. A large hunting knife, a pair of what appear to be machetes, and what looks like a small pistol. These are just some of the items recently seized at the Health Sciences Center. And according to data from Shared Health, an example of the hundreds of weapons that have been seized over the last decade. Now, the union that represents nurses in Manitoba is calling for improved security at the facility.
It creates stress, it creates anxiety, and that absolutely affects your ability to perform your duties. If you are continually worried that the next individual you call into triage or call into a secluded area to deal with has a weapon, that's always on your mind.
Darlene Jackson, president of the Manitoba Nurses Union, says it's concerning that so many weapons are making their way into HSC, putting everyone inside at risk. Between 2010 and 2021, there were a total of 371 weapons seized from the facility, including 240 knives, 46 tools and screwdrivers, 9 firearms, and an array of other weapons like brass knuckles and bolt cutters. Jackson says it's time Manitoba Health implements screening measures like metal detectors in certain areas to help keep both staff and patients safe.
So it makes me wonder why any member of the public can wander into a facility, a healthcare facility in the province with a weapon, and the staff have no recourse.
Jackson says there needs to be security improvements at HSC. While there is security on site, they act more as eyes and ears for police as opposed to an enforcement body. The number of weapons seized has dropped slightly from a record high in 2019. Jackson says this is likely because the HSC was locked down due to visitors during COVID-19. She says lessons learned during that period should be applied to improve safety.
During the last 2 years, we have locked down hospitals. We have made it very difficult for visitors to get in. We've seen a decrease in sort of traffic in the facility. So I think that has had a big impact. And so, that is one way. How can we utilize that information to ensure that our hospitals are safer?
Shared Health says security staff are trained to deal with situations that may result in a security or safety risk, noting they can and do seize weapons. Patients are screened and triaged, and in some cases are required to use a private locker for the storage of their belongings if they disclose or have identified a dangerous item. They say implementing blanket search protocol is not permitted in Manitoba under legislation, but protocols are reviewed on an ongoing basis, and work continues to develop a standardized security program and training model. Jackson says the government needs to do a better job listening to nurses. She stresses that MNU will continue to advocate for safer conditions for its members and for their patients. In Winnipeg, Morgan Majeski, City News.